what we're going to discuss now is needle retention time. Now, a lot of my students do ask me, how long do you leave a needle in place? And it all depends as to what you're treating and what kind of conditions you're treating. Let's say, for example, you just want to take a muscle out of spasm, or you're going to treat a myofascial trigger point, then the needle retention time is going to be a lot shorter. It could be anything from inserting the needle and taking the needle straight out. Otherwise, it could be a case of putting the needle in, leaving it for 5-10 minutes and taking the needle out. So that's going to be a different treatment technique. But however, if you're using more classical acupuncture points, then needle retention time is generally going to be a little bit longer. Now, what is the optimum time? Now, if I look at certain studies that's out there, and we're looking at more needle retention time, then you're going to find studies that have actually looked at using 10 minutes, 20 minutes, 30 minutes, and those who looked at 40 to an hour or more. The ones that's actually using anything up to an hour has been shown to be more effective. If you look at studies that's been done by Napido, in particular in 2005 and also in 2010, they basically demonstrated that acupuncture tends to have more of an effect after 30 minutes. And several other studies have actually come along that's actually demonstrated that, such as those by Lundeberg, and also studies by Boer. So again, they've demonstrated the longer treatment times, such as your 40 and 60 minutes treatment time, is much more effective than treatment times that's under the 30-minute time period. So ideally is to leave the needles in as long as you can, but however, in a clinical setting, an hour is not always an ideal based on time in which you have available to yourself. So it is going to vary, and also going to vary as to say, do you want a central response or a local response? A central response is going to take much longer. So in other words, if you're going to use such as a 4 gates, which is the liver 3, large intestine 4 on both sides, that's going to have more of a central response, and it's going to take time for the central nervous system to start to release those endorphins into the system, and that's going to take at least 20 to 30 minutes before that starts to happen. So in other words, if you're utilising the 4 gates and you only leave those needles in for around about 20 minutes, then you're not going to get the full effect. By the time you've taken the needles out, then the effect is just starting to take place. So it is important, if you're wanting a central response, do leave the needles in for longer, ideally 30 or more minutes in order to get that. So I'm hoping that's given you some idea, and again, because it's going to change from whatever condition you're actually treating as well. So, but hopefully it's given you some idea as to how long you're actually going to leave your needles in place.